Past, present, and future. That's the sequence. That's how it unfolds. Let's look back. When President Obama was candidate Obama, just a year ago when we did our last forum here, he was very clear about his domestic priorities. The economy was number one, and after that was health care and energy. And he has not wavered one bit. And if you look at how health policy has unfurled from the White House, I wouldn't be the first one to comment that it looks like a redux of reverse Clintonism. For if you go back to 1993, President Clinton wrote the first textbook. He came out in January, and at the end of the month, created a task force of federal bureaucrats, advisors, and counselors to ultimately produce a 1,300-page document called the Health Security Act. Enormous in its scope and complexity, and what was remarkable about it is it came totally out of the executive branch, not a whit out of Congress. It took until September before it was even introduced to the populace, leave alone gone through the committees. And the president, to demonstrate his commitment to it, said with a typical Clintonian gesture, it will be universal coverage and not one bit less. And he appointed his wife to head the task force, putting the bill forth as an additional sign of his resolve, not to mention her own formidable ability. And despite that ability and his resolve, it did not work. And we did not get health reform last time. No legislation. So this time we see President Obama really following a totally different script. No executive task force, just the opposite. This is Congress's job to propose the laws and make them. And it was the executive's job, at least until 2 weeks ago, to merely espouse 8 very broad principles and to partake in a very modest public relations campaign, getting information, regional forums, things like that. And Mr. Obama made it clear that he wanted something simple, not with labyrinthine complexity. Let's stick to what we're familiar with. He made it clear that he was ready to compromise. I have 8 principles, but I'm ready to give in. And oh yes, please get on it. Time is of the essence. And so now we've come full circle towards the end game. It's September, and 2 weeks ago today, President Obama took 8 principles and started to hone in on some of the things that he thinks are most important. And in Congress, we've seen the Congress do its job, still doing its job. 5 committees of jurisdiction, 3 of them in the House, Ways and Means, Labor, and Energy and Commerce, have produced H.R. 3200, slightly different variants out of each committee, but basically the same bill. The HELP Committee, Health, Education, Labor, and Pensions, and the Senate has produced a bill on the delivery system, but they can't touch finance. And the Finance Committee is marking up as we speak. There are some important points of agreement. First has got to be the change in the insurance markets. All of the bills call for something, be it national or state-based, some sort of exchange or gateway that will make it easier for those in the small group or individual market to get insurance efficiently. They also call for regulations of the health insurance industry, real changes such as guaranteed issue, guaranteed renewability, exclusion of pre-existing conditions, and limited risk rating. They call for expansion of the Medicaid program, not only expansion for women and children, which has been in there before, but for men and other categorical groups that we'll go through. There are 4 more provisions. There are individual mandates and employer mandates. That is to say, individuals will be required to purchase insurance or pay penalties, and employers of a certain size, it'll vary by bill, 25 or 50 members or a certain size payroll, will be required to purchase insurance or contribute towards it in another way. And then there'll be subsidies for individuals to help purchase insurance up to 400% of the poverty line, and for small employers who are willing to go out and buy insurance, there'll be tax credits. Those are the points of agreement, and yes, in the second decimal place, they all vary. And some of those variabilities are important about exactly how big the subsidies are and exactly how big the penalties are. But those are all places where I think the members agree and where I think we can get to yes. But there are some places where yes may elude us. Do we have a public plan? Is it state-based? Is it national? And especially in the details, how regulatory is it? What are the rules about competing and not competition? And how big are the subsidies that we're going to need. Tremendous difference from them. And where is the money going to come from to pay for those subsidies? How much of that money will come from Medicare cuts? How much of it will come from taxes on the elderly? How much of it will come from fees or taxes on health insurance firms that provide expensive policies? And what about the expansion of Medicaid? Are states ready for it? And is that expansion funded, or is it an unfunded mandate? And finally, as we try and move forward politically, it takes 60 votes, as everybody knows, for cloture. If they're not there, will we go towards reconciliation? All those are important questions, and they're exactly the sorts of questions that I'm hoping our panel focuses on as we move forward. Their charge has been to think about what's happened to date, to feel free to talk about what they like or what they don't like, what they think the opportunities are and the challenges are, and especially how they see this thing, whatever this thing is, playing out.